And I'll tell you my experience with speaking to the head of MaxHome when I was visiting India last year. I had a very good discussion with him. And what I learned is that around 15 to 20% of their post-hospitalization patient gets to MaxHome, right?
Mm.
They able to provide those services for MaxHome. But what is happening for the rest of them,
Yes, yes,
right? Those 80%, you don't know really what is happening with them and you don't
yes,
care about it,
yes,
right? And it's a large number. We are talking about Max as a group, almost doing 17,000 is, I vaguely remember that number 2 years back or 1.5 years back when I was visiting India. It was 17,000 per month,
mm,
right? Discharges, right? When you put that number into that perspective, you look at that. It's a big number to manage
yes,
post-hospitalization care for the ones who are not taking Max Home. Of course,
yes,
Max Home will, if we tomorrow we have this kind of a partnership with Max Home, which I do not, and at least I don't know if they use any kind of clinical monitoring software.
yes,
Okay, that will help them. That will complement what they're doing today. What if Rishikesh,
mm,
want to know what is happening with their parents when Rishikesh parents were admitted in Max, or Rishikesh is taking Max home services.
mm,
You still want to know that what is really happening with them.
yes,
That's exactly what where we will complement. Those clinical monitoring is so important. Whether it is done by nurse, firstly, is it recorded anywhere? Is that digitally available some anywhere? Is it giving me the right alerts at the right time? Of course, nurse is visiting, but
yes,
is the nurse 24/7 versus just visiting for an hour or two or whatever the need of the patient? How about the rest of the time,
mm,
right? How about the medication adherence of the patient? Like, is he taking medication? Is he missing medication? Is he taking more medication? Right? Who's monitoring that? So that's where we complement instead of I call that as a risk for us.